Well, hello and welcome to HealthLine. I'm Jennifer Blomquist. I appreciate you watching us this evening. If you're new to our show, I just want to let you know that we are live, doing the show live, and we welcome your calls during the program if you have any questions for our guest. We actually have an audiologist here. We have not done an audiology program in quite a while, so I'm really excited to do this show tonight with a brand new guest. And so let me go over some of the basics in case you are new or just need a reminder. Again, we're live in the studio, so if you have a question you want to ask, we keep that phone number up at the bottom of the screen for you. It's 969-2720. If you're outside of Fort Wayne, still a toll-free call. Just put an 866 in front of there. And then now, just a couple weeks ago, we started a new system where you can text in your questions. So that's nice. You can do that. The number's a little bit different. It's 969-2730. And I just want to assure you that we keep your phone number private. So your phone number will not come up on the screen if you text us. But if you don't mind just telling us your name and maybe where you're calling from, that would be great. But everything else stays private. Just want to reassure you about that. And then when you call in, you can ask your question live, which I would recommend because then our guest can ask you questions. You guys can converse with each other. Maybe that would help her to give you a better answer. But if you prefer to just call in the question, the call screener will take it and then relay it to me. And one way or the other, we'll get that question answered for you. So without further ado, I'll go ahead and introduce you to our guest. This is Dr. Lindsey Koble. And as I said, she is an audiologist and a brand new guest. We appreciate you coming on tonight.
Thank you. I'm so excited to talk about audiology and hearing wellness.
Well, and you know, it's something that unfortunately people kind of make fun of people who are hard of hearing. It's just, you know, even growing up, I mean, I'm a lot older than you, but growing up there were always jokes about, hey, Grandpa, can you hear me? Which is really pretty cruel. You know, I think people now, I think just in recent years are thinking it's not healthy for somebody to not be able to hear. You feel isolated. And it's just not nice to make fun of people. You know, it's just not really a joke. So audiology, I feel like that whole field has really opened up.
It really has. Just within, I've been an audiologist for about 7 years now since graduate school. And just within the last even 5 years or so, there's so much more research and attention being put on hearing health and brain health and kind of that combination of how important it is to hear well and to be connected to those around us. So I'm really excited to have this conversation.
And, you know, the hearing aids have changed. I mean,
they've changed.
I remember when I was growing up, I remember my best friend, Holly Steiger from second grade. She's in Illinois. I'm sure she's not watching tonight. But I remember Holly had to wear a hearing aid. And her mom, we went to a small Catholic school, and I remember Sister Carmel made her mom come in, said, you know, you should come in because she was afraid about the kids making fun of her because this thing was huge. It was, I remember it was like a brown colored, like big thing that clipped on both, she had them on both of her ears. And there was no hiding it, you know. And so, but now people tell me that there are ones that are like clear, that are like the size of like an earring. Yeah,
we see people all the time who say, if I'm wearing a hearing aid, I don't want the big beige banana.
That's what they describe,
like the big beige banana. And we've had people who, you know, remember their childhood, they had hearing aids and it was like a body worn where they had a cord up to their hearing aids. And so now they're really so small and discreet. You know, if you look at people in the grocery store out in the community, a lot of times it's a tiny wire and a little hearing aid that fits over the ear, much smaller, or they can be little teeny tiny ones that go all the way down in the ear. There are really so many options that we can use to make every patient happy with what they're looking for, so they're not as clunky as what they used to be.
Yeah, I think there's still that stigma, you know, and as I'm getting closer and closer to 60, I can appreciate it, you know, especially for people still working, you know, before retirement. You don't want your colleagues to think, oh, okay, you know, they can't hear well anymore. So.
And exactly, I mean, with that, like you said, there's such a stigma, especially in the working world, of people say, well, I don't want to be perceived as the old person. But I've also seen so many patients who come in seeking help because they can't keep up in meetings the way they used to before, or they're like, I'm on the verge of retirement because I feel like I just can't hear. I can't do my Zoom meetings. I can't keep up in meetings. I'm having to ask for repetition. So I feel like the old guy because I'm asking people to repeat, where a hearing aid might be a little more discreet.
Yeah. And it's my mom wears hearing aids, but I just thought she was going to put them on and that was it.
Yeah.
But there's a whole learning system to it. It took her a while before she said, well, they told me I have to like retrain my brain. Yeah. So is that I never got into a deep conversation with her about
There's
it.
really some truth to that.
Okay.
A hearing test is only part of the story. Everyone's perception to sound and how our brain is going to react to that hearing aid is different. That's why it's so important to have a really reliable provider to kind of walk through this journey with you, because you might adapt real quickly, but for someone who doesn't adapt quite as quickly, there's follow-up care, there's tweaks and adjustments in our really in-depth software that we have, and so every patient's different. And it may have taken your mom a little longer to adapt. The older we are, the harder it is to adjust to something new. And we know that as providers, and we're prepared to handle that as providers.
So how does it start? I mean, can you just go get it checked somewhere, or do you have to start with a primary care doctor?
Yeah.
Would that be a good starting point, I guess, if you feel like you're not hearing well?
A good starting point is always primary care. You can let them know that I'm having concerns with my hearing, and they should send you to a hearing care provider that they trust and have a good relationship with. Yeah. We don't always need a physician referral. So if it's easier for you to just pick up the phone and call an audiologist, that's equally as good. I think most audiologists and hearing care professionals would recommend that anyone really over age 50 should have a baseline hearing test, because there are weird things that come up with hearing that could be a sudden change. COVID did a lot of weird things to people's hearing. And if we didn't have a baseline hearing test to go off of before, we don't know how much things changed. So it's kind of like dental and vision. You see them about once a year. We recommend a hearing test, when you're 50, and then maybe 5 years later, and then once you start to notice difficulties.
Yeah, what would you expect as a patient? What would you expect to have done at that first meeting? I mean, I grew up where we were still doing the hearing test at school, and you raise your hand. Yeah. Is that kind of what you do?
It's similar. It can be similar. Most providers probably start with a pretty in-depth hearing history of what do you experience? Do you have ringing in your ears, any pain or pressure, any dizziness? So a pretty in-depth case history about you and what you're experiencing. That actual hearing test, some providers may still have you raise your hand or push a button to the beeps. Yeah. What's evolving is our ability to test how you process speech. So part of speech is speech clarity. So if you hear the word dog, does it sound like bog? Does it sound like sog? The clarity
you might hear
to speech.
Something, but just not
quite make it out.
What it is. Okay.
And then also hearing and background noise is so important. And usually one of the first things that people recognize is when I go to that Texas Roadhouse on Friday night, I just can't keep up. And so we now have a diagnostic test that can see, do you break down sooner than others in a difficult listening environment? Okay. So after the provider does the whole test battery, usually they sit down and try to explain it to you. It can be very confusing, but to make it make sense and put it in kind of lay terms, that's really what we try to do.
All right. We have so much more that we were going to talk about, but I do see that somebody texted in a question, so yay, we're glad people are using the new system. This is a good question because I know that they're not cheap. This person wants to know, why are hearing aids so expensive?
That is a very good question, and it's a very common question. And I think probably what you've noticed from your mom's experience having hearing aids is when you purchase hearing aids, it's not a one-size-fits-all approach. Yeah. When you're purchasing hearing aids, of course you're buying this really technological device that so much research and development has gone into. So the device itself has an expense to it. The other part of the expense to hearing aids is the provider that you're paying for. Okay. And oftentimes you are investing in having that provider walk through this journey with you for a certain set of years. So it's usually more of this kind of package deal of, I understand I'm buying a widget in the device that I'm expecting to really help me, but you're also paying for the provider's expertise to get that set to you. So it can be expensive, and it's a combined approach of what you're getting.
somebody, this is kind of a joke, but somebody told me if you're going to the audiologist, if you're a man, your wife needs to go with you. because a lot of and my husband's the same way. He does have hearing issues. But I think he doesn't want to accept it. You know, and I understand that. But then I was talking to an audiologist years ago, and they said, we always recommend that the spouse come with. Because also they said it's or whoever you live with, your living environment, those are the people who are going to know. Like you might say, oh, I think I hear fine. And the other person will say, I was sitting right next to you and you couldn't hear me. Sometimes other people around you perceive it differently.
Oh yeah, and having that spouse, or even sometimes we say bring a friend if you just have a friend, but to have that familiar voice and kind of backup of what do you need and what's important to you, especially in that initial buying decision, what's important to you in that process. So it's really nice to have that spouse or friend along.
It's probably to their, they want what's best for you. If it's somebody you care about, I'm sure they care about you. And so they're
it's a big decision. And it's a lot of information is what we recognize. It's a lot of information, and it's a lot of new information most of the time. So having someone else after that appointment to say, what did they say about that? It's really helpful.
So once you go and again, it's not something that's going to be fixed overnight. So if you go and you have the initial visit and the hearing test, what do you say to somebody like, maybe in another month or so, we'll have you kind of back on track? Or what's a reasonable expectation?
Typically, we do that initial consultation visit where we figure out what you need and what makes sense for you. Once we fit the hearing aids, usually patients we have to order based on what you need and what you want. We do have to place an order, and then those hearing aids come in and we do a fitting, a week or two later.
When you get eyeglasses.
Kind of like when you get glasses. We do a fitting, then we have you come back in another couple weeks to see, okay, now that we've done our fitting and our prescription that we think is what's best, go out to your world, test these out, and come back and give us a review. And so really kind of the first 60 days are an adjustment period is what we call it. And so it takes really kind of the first 1 to 2 months to get really dialed in. After that, you see your audiologist, maybe every 4 months or so, just to touch base and make sure everything's going okay.
All right, got to be a little patient.
So. It takes time.
Well, we did have another person call in and wanted to, they called, oh no, it was a text, sorry, I think it's Wesley. Wanted to ask a question about over-the-counter versus prescription hearing aid, which I didn't realize until like a year or two ago that was even a thing.
Oh yeah, because I thought, of a newer thing.
Wow, I don't know if I would, all this information you're giving me, I'm thinking, how would I know what to order?
So the main difference between an over-the-counter and a prescription hearing aid is over-the-counter is exactly what it says. You can purchase these at Walmart, you can purchase them at Best Buy, you can buy them on Amazon. An over-the-counter hearing aid, I describe it very much as like a DIY approach. So you can buy the hearing aid in a box off the shelf. Oftentimes now they have a do-it-your-own hearing test.
Even like your own, you adjust them yourself.
Built into it. Some of them have an app that you can control, but they're very limited. They're very limited in how they amplify sound. They're very limited in the technology that's inside of them. I like over-the-counter as a starter device. Sometimes people think, I don't need a real hearing aid, or I don't need to go to an audiologist yet. So they try an over-the-counter device and they recognize the benefit that they can get from that cheaper device, but 9 times out of 10 people say, okay, I'm ready to do the real thing. I'm going to come see an audiologist. So a prescription hearing aid just has so much more technology built into it from the major hearing aid manufacturers to do more automatic adjustments in background noise, to soft sounds, to soft speech sounds. And when we pull up a software, we have so much control in that prescription hearing aid, and we have so much education to dial that in based on what you're telling me. So over-the-counter is kind of this DIY approach. Prescription is I'm making an investment in my hearing, and I'm investing in the provider to kind of walk through this journey with me.
And it is a journey for sure. So, and and there's also, and like we kind of touched on this, there's that emotional aspect to it. people, I know, especially I noticed this with my children, and if you watched a few years ago, I shared this story about my husband has had horrible issues with his ears, and sometimes if he gets really sick, or he's had his eardrums rupture before, he can't hear, and sometimes for weeks at a time, and it was a major turnoff to our kids. They didn't, it was such an effort for them to communicate with him that they didn't. And I would say things like, you got to say goodnight to Dad. Well, he can't hear me, so, well, you still should say goodnight to your dad, you know. And it's that way even with some adults, but especially, you know, if you have grandkids, you know, it's like, I don't know, it doesn't really scare them. It's just kind of like, well, you know, I go talk to Grandma, but she doesn't hear me.
And usually that's the trigger point for some of our patients is they say, you know, I am here, I've had hearing loss for years, but now that my grandkids are getting old enough, they want to tell me about school. They want to tell me a story, and I want to hear it because it's frustrating for them, a 6-year-old, when I say what all the time, and they just say, Grandma can't hear. And they say, I'm sick of Grandma can't hear, I want help. And it really is an emotional thing, and that's the rewarding part of our job, is that we get to be a part of that really emotional journey to change someone's life for the better. So it's a tough conversation in the beginning. No one wants a hearing aid, but it's really an empowered conversation on the back end of it.
Well, I saw a picture of a man who was totally bald, and he was wearing hearing aids. And I was reading it when I was doing some research on this. I kid you not, the guy had not a single hair on his head. And there was a picture of him, and it was kind of up close, and you couldn't tell that he was wearing them.
From the back, maybe, but up close,
true.
no.
It's true. The rumors are true. So, what is I guess the situation with insurance, because I'm you know, that's
such a loaded question. A good question.
And most of the people probably getting hearing aids are probably, you know, retired at this point. So,
you know, there is so much confusion out there with insurance. But what I would tell you is look at your insurance plan. If you have an insurance agent, ask them, do I have a hearing aid benefit? The Advantage plans right now and some of the supplement plans are now offering like a hearing aid discount plan. And I would say really look into what that discount plan is. Some are great, some aren't as great as others. And really what I mean by that is some of those discount plans do offer you a choice of brand. Some of those discount plans really offer great pricing, but you might be really limited to what you can choose from that.
That's true.
You know, and so you kind of have to decide, is discount and price most important to me, or is choice of I want the best that's out there? And that's really a patient by patient decision. You know, if price is your driver and your insurance has an option, go that route. You know, as long as you have a good provider by your side, we can really make anything work. But unfortunately, some insurances, some employer plans don't have any hearing aid benefits. I wish they all did, but call your insurance card and check, and then see who's in network. And I would probably start with an in-network provider to see what they can offer you, and then go from there.
I always think of it like, you know, to me, it seems a lot like vision care. You know, it's like,
so
you know,
similar.
Sometimes they'll cover part of the exam and then give you $50 for the frame. You know, it's just, you have, it seems like it's kind of a similar situation.
I mean, in our office, the insurance plans cover a very kind of strip model portion of that hearing test that we were talking about. We offer to do a more comprehensive approach that I wish we could do every time. Insurance just doesn't pay for it. So you can choose to pay out of pocket. I think that's how most offices are. And it's just, you have to be educated on what your insurance offers, and then decide what's important to you, cost or the best care.
Well, are there times when, I mean, we've talked about, you know, you've talked about over 50 or 50 and over, you know, starting to address it. But are there times, even maybe when you're younger, that it would be normal to have hearing loss, whether permanent or temporary?
Yeah, I mean, there we see people who have wax in their ear.
So I've heard of that.
So they come in thinking, I just can't hear very good out of this ear, and we find that, well, you just have a wax plug in your ear, and we need to use our water and flush that out of there. You know, ear infections. This winter, so many people have been sick.
Yeah.
And so you could just have plugged ears. So we can look in there, do a hearing test, and we say, you know, this is a temporary type loss. You need to go to your primary care doctor or an ENT physician, and they're the ones who can help clear up what's going on in there. But then we have people who are hunters, construction workers, people who have had hearing loss their whole childhood, and now that they're working in their 20s, they recognize that something's off here.
Yeah.
So there's so many things that can cause hearing loss, and really no age is too young to check.
And I mean, is pretty much everybody guaranteed to have some hearing loss as they age?
Correct.
Is that just typical? I mean, we experience it with our eyes, for sure. But
As we age, our hearing will gradually decline slowly. That is just bound to happen to all of us.
Okay.
Yeah, and some people, it progresses faster than others. That depends on your work history, your family history of hearing loss. All of those things can have an effect on how you're affected versus how I'm affected. But gradually, kind of like any other muscle in our body, it starts to gradually decline.
I can tell you from experience, the eyes go first. My hearing's still okay, the vision not so much.
Vision is going.
So we did have somebody else who texted. I'm so excited people are using the text message. I feel like we're getting a lot more audience interaction. So they wanted to know, how can I prevent hearing loss as I get older? I mean, is there anything you can do to at least prolong, you know, your good hearing? So.
Such a good question. I've been thinking about this recently. I watched the IU football game recently, you know, that national championship game. And it was so loud from watching on the TV at home that I'm like, all of those people in that stadium are experiencing this noise that is it causes permanent hearing loss, you know, even if you're only in there for a temporary amount of time. So if you go to a concert, you go to a band concert, you use a loud tool, I would always recommend hearing protection. Hearing protection doesn't have to be fancy or expensive.
Can it just be those little, like little styrofoam plugs? Is that enough?
My recommendation with the little foam plugs is really roll them down as tight as you can. And most of that plug should be down in your canal. It shouldn't just be kind of hanging out. And so any sort of hearing protection is really the ultimate way to prevent age-related hearing loss, especially for people who work construction, hunters, farmers. But anywhere that you go, we've all had that experience where we go to a concert and then we leave and our hearing seems kind of muffled and our ears are ringing. That is a temporary threshold shift, which is damage to our hair cells, and usually we recover from that, but over time, that's what causes that permanent loss.
Yeah, all right, good things to keep in mind. So I've got another question for you. Get another texter.
I love it.
Let's see, how can audiologists help with, I've seen this pronounced two different ways, tinnitus or tinnitus. But like you said, it's the ring, it means the ringing of
the ringing in the ears. So I like to always put this out there that there is no cure for tinnitus. So everyone wants a cure, because really what tinnitus is it's an unwanted ringing, buzzing, hissing, crickets. And oftentimes it's perceived as in our ears. And it's really a response from our brain. And so really when they do studies and MRI scans, tinnitus is showing up in our brain. But what we know is that it's a response of decreased input coming from our ears. So when we have that damaged hearing, our brain isn't getting quite as much sound as what it typically is when we have normal hearing. So our brain produces this extra sound that's perceived as the ringing, buzzing, whatever it is. And so when you see a hearing healthcare provider, they're looking at your whole hearing system, and their goal is to give you tools. One, to understand what it is. There's a lot of misinformation out there about tinnitus and the threats and what's causing it and all of those things. We like to get to the bottom of what it is. And it could be a lifestyle change, blood pressure, caffeine intake, medications. All of those things can also cause ringing in the ears. And so a good audiologist will get to the bottom of what's causing it. And then there's modes like sound therapy, cognitive behavioral therapy, hearing aids are a tool to help with tinnitus. And there's a lot of research going on right now about tinnitus management and tinnitus care. It's such a loaded topic. We spend 90 minutes with those patients because it's really in depth and really intense. And those patients carry a lot of stress and anxiety around it.
Well, yeah, because that could happen any time of the day. So I can't imagine trying to sleep. Or concentrate.
That's typically where it affects people. Is it affects them sleeping, or I work at a computer and I am in a quiet office and all I can think about is this ringing. Or it's affecting, at night I sit down to relax and I can't even talk to my wife because I feel like all I hear is this ringing. And so us trying to offer tools and understanding is the best approach to handle tinnitus care.
Well, we only have about 30 seconds left, but in most cases, can a hearing aid restore your hearing, or just helps you to cope with it?
Unfortunately, no. Hearing aids will not make your hearing like it was when you were 20. But hearing aids are really good these days, and they can make it better, but we're still working through that damaged auditory system.
Okay. Wonderful. Thank you for the concise answer. So I hate that the show is almost over. We could talk for 90 minutes about this. So,
we could.
Well, you'll have to come back.
Yeah, I would love to.
Well, wonderful to have you. Again, Dr. Lindsey Koble, audiologist, thank you so much for your time. Really appreciate it. Thank you to all of you who contacted us tonight with your questions. Great questions. I'm Jennifer Blomquist. Take care. Have a wonderful week, and we'll see you back here 1 week from tonight. Bye-bye.
PBS Fort Wayne was made possible in part by
Audiology Always, providing hearing aid fittings, diagnostic hearing evaluations, earwax removal, and tinnitus management guidance. Your hearing always matters. More information at audiologyalways.com.